Welcome back. Dr. Christine McKibben and Kevin Franke are still with us to discuss Rural Frontier Care Transitions Project ECHO. So Kevin, we were talking about Project ECHO in Montana and Wyoming. Let's finish that discussion.
Thank you, Sarah. You bet. And like I said before, it was basically born out of a need. You know, our work that we do with Mountain Pacific with the states, we do it at a community level. And our whole goal is to build communities around the patient to make sure that the transitions from one level of care to another are taken care of, and we try to eliminate those gaps. We do it a lot in our previous work, but due to time and resources, at Mountain Pacific, we try to decide or figure out how we can get to those rural frontier areas of both our states, who are huge geographically, and we have lots of little communities out there that don't get the advantage of the education and a lot of the areas of expertise that we're allowed to, that we are able to give. We've had a strong partnership with the University of Wyoming and the Center on Aging from Mountain Pacific and us for a number of years, and we've been working on projects together, and we just thought this was a perfect opportunity for us to take the Project ECHO out into the field. One of the main things is that, in the original Project ECHO, it talked more about disease processes and more about specific disease, like it started it with hepatitis C. In care transitions and in care coordination, it's more about the process. It's more about the process from one area to the other. So what we're doing is helping coordinate that care in those smaller communities with those providers, and hopefully doing it the same way as we would do one-on-one with those providers that we were able to do it with.
So we talk about complex health conditions, and we talk about ways of managing that. Can you talk about the work you're doing to help those patients? You bet.
And like I said before, many times, when we're talking health conditions and in care transition, we give good medical care. We have good medical care in the states of Wyoming and Montana. But where the process and where it's broken down is in the process of care coordination. It's meaning, somewhere in between the hospital and the primary care, between their hospital and home, between the primary care and the specialty physicians, there's that communication gap. There's three things and three barriers that always are on the forefront of being part of, when we're talking care coordination, communication, education, and accountability. But when we talk about complex health conditions, we're talking about those people with diabetes who, they need their care with their dietitian, they need their care with their diabetic educators, they need their care with their endocrinologist, their primary. Well, those are all areas where things can fall through the cracks. And so what we're trying to do is develop and help that process so that patient has a smooth transition from the other. Same way with heart failure. You have your cardiologist, you have your pulmonologist, you have your primary care. So all these areas, we're trying to help that transition from one level of care to another.
So Christine, talk to us about the difference between telehealth and Project ECHO.
Yes, well, telehealth works directly with a patient and is a direct link between a provider and a patient to manage a particular disease or illness or issue in that patient. Project ECHO is different in that it's working with a team of experts and providing education to providers as they manage their patients.
So Kevin, can you give us an example of a case that's actually used by Project ECHO?
Certainly, in our sessions, it's about an hour, and at the beginning of each session, it's 30 minutes. We go over a case that's delivered as Christine said, from one of the spoke sites, and the expert hub. We all have this ahead of time, and so we're looking at recommendations, and so the case is presented, and then we have a short topic discussion and didactics. But an example of a case that I think is universal is, especially in our rural areas, is a patient that had come home was in a hospital 100 miles away at a regular tertiary acute care center, and was discharged back home 100 miles away. Well, the patient was end-stage heart failure. The cardiologist had made numerous suggestions to the primary care on what could be done, whether it be palliative care or treat medically or so forth. But many times that gap and that communication between the specialists and the primary care and the family, or the primary care and the nurses, gets lost. And so what we try to do is look at the process, look at where it was at. And in this instance, the primary care did not get the information from the cardiologist. And so the continuum of care was broken right there. And so the patient was in influx. So what we do as expert teams, we give them suggestions. Did you try this? Did you work with the other areas or other resources? Did you look at all the other resources in your area to see what we could do? What is your process between communication between that cardiologist and your office? How does that work? Do you get everything? Do you get the discharge instructions? So what we do is we look at the areas in where the gaps were and try to fix them.
So you believe that you're really making a difference with Project ECHO in Montana and Wyoming. We just have a few seconds left.
Certainly, I believe from the recruitment and from the areas that we have been able to get to participate, we have had a number of areas and number of care transition folks that have said, yes, thank you, we're getting the information now.
Thank you. Now that you know more about Project ECHO, stay tuned to learn what a hospital in Dillon, Montana is doing to improve the transitions of care for their patients. We'll be right back.